Our first speaker this morning needs very little introduction, I suspect, to quite a few of you, but he's going to get one anyway. Professor Geoff Cleghorn, it's just a little one. Professor Geoff Cleghorn is the Deputy Head and Director International of the School of Medicine at the University of Queensland and a Professor of Paediatrics. His extremely impressive and lengthy credentials are listed in your programs. He's kicking off proceedings today with basically the nuts and bolts of infant reflux in his address on the diagnosis and medical management of infant Gord. Please welcome Professor Geoff Cleghorn.
Thank you, Joanne, and thank you for all of your team for the hard effort and work that's gone into sort of putting on this symposium today. It was interesting to hear you talking about the precursor of Reza and Visa back in 1982, and I will acknowledge the fact that I was actually the first medical advisor to Visa back in 1982, so that just puts you a reflection about my longevity and/or dinosaur nature of my career. And it's interesting to, I think, reflect back in those days too, and when we started this journey with respect to reflux, it was then myself and my colleague Ross Shepherd and I, we were looked at being the sort of, reflux within the profession was seen as being the Brisbane disease. Babies in Brisbane vomited and had reflux, but no one else in the country did. But it was actually reassuring to us that in fact that babies in the United States and Europe and other places vomited as well and had reflux. So we weren't the outliers, we were just simply ahead of the game perhaps. So clinically, a baby with this irritable baby who might be because of reflux can present with regurgitation and vomiting. That's the norm, and I used to say to babies, this is very much a clinical diagnosis in the main, and when people come into your office or your rooms with a nappy over the shoulder, reflux has been diagnosed. So these are some work in looking at this as what's normal, what's problem crying. So endoscopy. It certainly allows you to visualise and biopsy the esophageal epithelium. It allows you to look at the presence of esophagitis and other reflux disease and complications. It allows you to differentiate between forms of reflux, and it's certainly, as the topic of the next presentation on eosinophilic esophagitis, without endoscopy we wouldn't still know that this is an entity in its own right, and certainly